Hi guys, it's Miss Medic here, and today I'm going to answer the question, is snoring normal? This is quite a difficult question to answer, as snoring can be normal, and a patient may have no underlying health condition, but be a snorer. However, there are cases where snoring indicates a more serious underlying condition. That is obstructive sleep apnea. Snoring can create social issues and cause friction in a relationship as the snorer interrupts their partner's sleep. It is defined by turbulent airflow through narrow upper airways and is more commonly seen in men due to increased fat deposition around the neck. Other significant risk factors are sleeping supine, alcohol, and sedatives. Snoring may be a symptom of obstructive sleep apnea, and in this condition a patient will have narrow areas which collapse during their sleep and lead to hypoxia. And this is when not enough oxygen is getting to the tissues. The stoppage of this airflow due to the collapse of the airways causes the patient to wake up. And the patient will typically grunt and work very hard at their breathing to get that oxygen around their body. There will be an increase in pulse, an increase in blood pressure of 50 mmHg, and there will be a catecholamine release. The patient will also be using intercostal muscles to work very hard to get their breath back. In a clinic, if you see a patient with these symptoms, it is important to get a good history and perhaps take a history from their partner as a collateral source. If you suspect the patient has obstructive sleep apnea, it is useful for them to do the Epworth Sleepiness Scale questionnaire. And also, when taking a history and examination, check for the following: alcohol use, sedatives, large neck, which is a neck circumference greater than 33 centimeters, and anatomical features such as a large tongue, a small mandible, enlarged tonsils, and a deviated nasal septum. Also ask the patient do they have conditions such as polycystic ovary disease and diabetes. Patients who are very sleepy should be advised to stop driving and inform the DVLA immediately. If you suspect obstructive sleep apnea, it is important to investigate it thoroughly. Overnight pulse oximetry can be useful. A drop of 4% in the sets may equate to a desaturation. However, there are limitations of this test and it is not ideal. A sleep study is a better alternative as it is more thorough. Patients are fitted with a pulse oximeter, a thoracic and abdominal belt to measure respiratory movements, airflow sensors, and snore sensors. Full polysomnography is not always necessary in patients presenting with obstructive sleep apnea. It involves additional tests such as EEG, ECG, and EOG to detect rapid eye movement. However, this is a very advanced and expensive test, and sleep studies may be used as an alternative. Patients with obstructive sleep apnea are managed by encouraging them to lose weight if overweight. Mandible devices can also be implemented. They can also use CPAP, which is positive airway pressure. They will be fitted with a mask which exerts positive pressure, which prevents the airway from collapsing overnight. It is important to diagnose and treat this condition, as it can lead to cardiac complications if untreated, such as hypertension and metabolic syndrome itself. This is thought to be due to the release of catecholamines during arousal from sleep. I hope this answers the question, is snoring normal? And if you enjoyed this video, don't forget to like and subscribe for more videos.